Hi, everybody. I'm just monitoring the participants list, and I think all those who are trying to get in, they are now in. It's 2 minutes past the hour. Maybe we get started as more participants they join us as we proceed. Very good afternoon, everybody. My name is Kelvin. Good afternoon from Cambodia, where I am based. I work for GIZ in the Social Protection and Health project here. I have the pleasure to be the moderator for today's webinar. The webinar today is hosted by socialprotection.org, as you are aware. It is organized by GIZ and WFP, also with collaboration with the Ministry of Planning of Cambodia. The title of today's webinar is Strengthening Shock Responsive Social Protection in Cambodia, Lessons Learned from a Cash Transfer to Households Affected by Multiple Shocks. The Cambodia social protection system is built on an important foundation. It is the IDPoor program, as we fondly call it here, the Identification of Poor Households program in Cambodia, which is operated by the Ministry of Health. It provides data for social assistance providers in Cambodia, and this program was used in combination with WFP's satellite-derived flood extent information system, the data to assess poor households which are affected by a devastating flood a few years back. So today we would spend some time to unpack some of the details of the IDPoor system, the satellite-derived flood information, and also look into the WFP implemented cash assistance program in Cambodia, which was running from April 2021 until March 2022. This cash assistance program operated by WFP was extremely interesting. It marks the first ever grant agreement between GIZ and WFP. GIZ was providing financial support to this particular initiative on behalf of the German Ministry of Economic Cooperation and Development. And this webinar will also look into or touch upon how this IDPoor database that we have is now changing in the face of so many shocks that Cambodia is facing, and how the overall social protection system of Cambodia is also slowly evolving to become ever more shock responsive. The presentation today can be, for those of you who are interested for more details, there will be a publication coming up. We will publish this or announce it when the time comes. It's done by Oxford Policy Management on a review or a kind of documentation review of this particular initiative, both on socialprotection.org, I guess, and also WFP's website that would come up later. Without further delay, let me introduce to you the speakers that we have here today. First is Mr. Chia Radet. He is Deputy Director, Identification of Poor Households Department at the Cambodian Ministry of Planning. We have also with us Kurt Bruja, Program Policy Officer, World Food Program Cambodia, and my colleague Sophie Hermans, Advisor at the Support to the Identification of Poor Household Program at GIZ. The presentations we estimate will take around about 30 to 40 minutes. Please, as you listen, do feel free to put your thoughts or questions that you might have into the chat. And we would have around about 20 minutes, 15-20 minutes at the end to have the questions addressed by the panel of speakers. Then as the next step, may I request for, I think Mr. Radet, you would be sharing the first presentation screen. Could you try to upload that?
Could I start now?
Yes. Do you want to upload it and then I can?
Upload to the chat, right?
The screen. Are you going to share the screen?
Yeah.
Okay. As soon as I can see it, I'll hand over to you to start.
Do you see my screen
now?
now?
Yes, sir. Perfect. Loud and clear also, I hear you. Please proceed. Thank you.
All right. Thank you very much, Radet, for sharing. And thank you very much, Kevin, for the introduction. I hope you can hear me all well. If not, I assume someone will interrupt. All right, I see a thumbs up. Okay, so thanks a lot for the introduction. As Kevin said, I'm Sophie Hermans. I am an advisor to the GIZ IDPoor project here in Cambodia, which has been supporting the Ministry of Planning and in setting up the IDPoor program for over a decade now. So I'm very happy to share the presentation with Radet, Deputy Director at the IDPoor Department of the Ministry of Planning. I will start and give a little bit of background information and then hand over to Radet, who will go more into how the system has changed recently and how in that change the overall social protection system, the shock responsiveness of the overall social protection system in Cambodia has improved. All right, so with no further ado, let's get started with the next slide. My Wi-Fi might be a bit slow, so I'm just assuming that everyone can see the next slide and I will just continue. Okay, I see nods, so that's the case. I will start with a bit of background information because not all of you might be familiar with the context in Cambodia. Cambodia in general ranks in the lower third of the Human Development Index and has some of the worst inequalities in the region. There has been a positive development in the recent years, but due to COVID, the share of people who live under the poverty line has increased again in 2021 to about 17.8% of the Cambodian population. In addition to that, Cambodia is one of the countries that is most affected by climate change, and climate shocks frequently happen, in particular flash floods that happen often during the rainy season between May and October here in Cambodia. So these are frequent events that happen and make life harder for people who have already problems sustaining their livelihoods. With this background, the IDPoor program was set up so that there can be an effective poverty alleviation, and a coordination of efforts towards supporting households and families that live under the poverty line in sustaining and hopefully improving their livelihoods. All right, so with that background, what is the IDPoor program? The IDPoor program stands for the Identification of Poor Households program, as Kevin has already mentioned, and it's mandated by the Ministry of Planning here in Cambodia. It's the government's standard, mandatory standard tool for targeting pro-poor measures, and it provides regularly updated information on poor households. So what does it mean in detail? It means that MOP always provides updated data, and the local administrative structures on commune council actually collect the data. So on commune level, people go out, interview households, and based on this interview, each household gets a score via proxy means test, and then the communes decide based on this proxy means test score and based on special circumstances that might overrule the proxy means test score, whether or not this household is poor. This data is then sent to MOP, and MOP manages the IDPoor database which allows data users, which are social service providers in Cambodia, governmental and non-governmental, to use the data to target their interventions towards these poor households. So this is IDPoor, and the overall objective of IDPoor is to reduce a duplication of effort and resources by different institutions, of course, so that not everyone has to go out and identify the target group for themselves. And also it ensures that the social assistance, the different parts of social assistance are well coordinated and provided to those households that need it the most, so that they have a better chance in improving their livelihoods. And I think with that, I hand over to Radet.
Okay, thank you, Sophie. So you already finished the objective as well, right? I forgot to move the screen to move the slide to the new slide for the objective. Sorry. Yeah. So okay, so again, thank you, Kevin and Sophie, for your introduction. And so again as well, my name is Radet, Deputy Director of IDPoor, Ministry of Planning in Cambodia. I'm also working here around 4.5 years already in regard to the data management part. Yep. So I will continue the presentation from Sophie. So next slide is that we talk about the IDPoor contribution to the shock responsive social protection in Cambodia. First case is that I think maybe some of you already know that in Cambodia we have another additional identification called on-demand identification. For on-demand as a background, actually it was pushing to be launched earlier than our plan by the government. So in the mid of 2020, the government has the idea and budget that want to provide support for the cash transfer to the household that affected by COVID-19. So they just looking for the tool and the data that already exists in Cambodia. So at that time, which is IDPoor data, which is we has a large amount of data, also household, and we has the data on individual as well, to all level of the area in Cambodia. Like we have the data from national until the village level. So which is benefit for the cash transfer. So for OD IDPoor, we actually the pilot was since 2017, as I remember, yeah. And the plan is just maybe to step by step launching it by province within 2020 to 2021, something like that. But because of the decision from government, we are pushing to introduce it to nationwide by the mid of 2020. Some core feature that has with the on-demand IDPoor, which is the effectiveness, is that the on-demand, we use the mobile application to operate and collect data, so we can avoid of the misleading data, or some the data is really more complete compared to what we used before as the paper-based. And for on-demand, it continuously available, meaning that before, if we compare to the round data collection, so in each area, in each province or village, they have only around maybe 3 months for the data collection. So if your household fall into poverty after the data collection, you have to wait another 3 years until the new round started. So, but for OD IDPoor, it's continuously available for citizens, for people who fall into poverty to request for interview. And also now it's kind of considered as a gateway for the vulnerable citizen to access the government or non-governmental social assistance program that are available in Cambodia as well. Also, after because of using the mobile data, mobile application, so the data that delivered to the server, to the database, also fast compared to what we have done before using the paper-based and using the data entry company. Yeah. So it also benefit to allow us that we have a timely response in the event of the shock or crisis, something like that. Yeah. So I think for the cash transfer, this is some number as well. During the cash transfer in the mid of 2020, we have around, we identify new household around 178,000 new household in the period of 4 to 5 months at a time. It's, the number seems like, but I think we can accomplish that because of kind of we doing a full campaign nationwide in together everywhere. That's why the number, that's why we can get the number really high. And another identification, I think we also from the government side that we have started in the bit of 2021. We call it the actually emergency identification. It's to the idea of this emergency is to the government was aimed to provide one-time cash support to the household or vulnerable household that living in the area of the lockdown measure. So from the government side, there has budget, there has the target group, but they don't have the identity who should get the support. So we are got assigned for this task. So first of all, I think at the time we designed a new short version of the questionnaire from the IDPoor, and then additional with some criteria that we define together with stakeholder, and I build another function on the existing app, which is on-demand IDPoor. So we have the app that available everywhere, and then we develop another function include to that app. And at that time, we also got the volunteer group around, as I remember, more than 1,000 people additionally to help us on the interview to collect the data. So I think within the short period of time, first round, we identify around 70,000 new vulnerable household for the first round. And also there's a second round around 50 more. So we in total, we have around 120,000 household to be identified and provide one-time cash support for the lockdown identification. So the next slide, it's regarding to the extension of the coverage. So now in IDPoor, we only cover the poor household, but by the end of this year, government already decided and assigned the task again to IDPoor to also identify the household that above the poverty line, which means that maybe potentially we call them as the at-risk household, but it's not official yet, but it's kind of. So because of in the new IDPoor database, we use the questionnaire that based on the consumption per capita. So for that questionnaire, we can adjust the threshold to some certain areas. So here, the idea is that we might looking for another threshold for at-risk and also adjust our procedure as well to really include those at-risk household. I think until now, the definition has been defined. Also, the identification, we aim to start by the end of this year, yeah, for this extension. So next slide. Yes, so another one, another dimension from the contribution is that IDPoor, we also, actually it's the long-term idea already, but I think this year is the year that it could be complete for us between also IDPoor, World Food, also together with NCDM. That we could accomplish this. So the idea is that to integrate the platform for real-time impact situation monitoring, the PRISM system that operate by the NCDM National Committee of Disaster Management. So from the data in PRISM, it's combining information from satellite, maybe kind of early warning system, to also have the household vulnerable and the field assessment to assess potential risk and estimate the impact of climate hazard or the most vulnerable community. And I think in the future, what we want to do is that in IDPoor, we have the data of poor household and potentially at-risk household as well. So we want to have kind of dashboard within our system to be able to cross-check with the data from PRISM. Like we can looking for where is the area that has the, maybe looking for the flood-prone area, the area that has the flood more often, and we can cross-check with that area to see how many people are poor over there is there, or how many at household is there together. So it's really easy to provide the support in case there is a shock happen in that area. This is the idea. Yeah. And the way forward is that I think our aim is at the end of this year, we want to launch our new database together with not together maybe. I think from the new system is that first, as I mentioned before, we have the round concept. So round concept will be replaced it by the continuously identification. So we don't have round anymore. So the gate is always open for vulnerable citizens or people who fall into poverty to get the interview. Yeah. Also, our aim also to, by the end of this year, we also do the re-access to the household that the activity card also expire, and the new questionnaire or new scoring will be published and launched together. Also, we are introduce our new website for better for providing a better information, also the action from the government, what we are doing, something like that. Yeah. And we also introduced the fully digital data collection and management, digitalized data. Yeah, because from this system onward, there's no paper anymore in IDPoor. So everything is fully digitalized, including monitoring as well. We also develop a digital tool in monitoring. Another important as well is that we're going to introduce the public IDPoor app. So what is the public app? So the public IDPoor app is the online platform where people can request for interview or provide objection or complaint to what maybe the local authority is doing at the ground. They can complain, they can provide feedback, and all of those feedback, requests, complaint will goes into the certain level that we will assign to. For example, if I am request for interview, the request will come directly into another platform, which is IDPoor app, that using by the commune council or the commune working group. So every people that request for interview from public IDPoor app, it will also synchronize to another app that using by the local authority to see that there is a people request for interview, so they can decide whether to go to interview or not. Yes. I think this is we see a lot of benefit as well, because it will be available on both Android and iOS version for everyone publicly, and you can also request anonymously, or you can create the user for better tracking where they are, or to see where is the progress of each complaint or request as well. So the citizen or community representative also request for interview on behalf of the household as well. It's possible from that. I think from my presentation, this is the end. Thank you for your time.
Thank you very much, Sophie and Radet, for your informative presentation. I see already some questions coming into the chat box. We will address them at the end of the second presentation. I would like to now immediately hand over to Kurt. Please, the floor is yours. I think we need colleagues from socialprotection.org to help us upload. Here it comes. There we go. Kurt, please.
Great. Thank you, Kelvin. Good afternoon. My name is Kurt Burja from the World Food Program. Next slide, please. In 2021-2022, WFP implemented a cash transfer program to support households impacted by multiple successive shocks and stressors. These included large-scale flash floods in October 2020, shown in the map here, which affected roughly 800,000 people in 19 provinces. Many of these areas had a very high concentration of IDPoor households and are historically flood prone. There was also the continued socioeconomic impacts of the COVID-19 pandemic on the poor and vulnerable. Related additional stressors included 2 large influxes of migrant returnees from Thailand due to the COVID pandemic in 2021. And on top of this, flash floods occurred again in many of the same areas that had occurred in 2020, also in September 2021. The objective of the cash transfer program was twofold. First, we sought to fulfill beneficiary households' essential needs, including access to food, and support recovery to these shocks. This was very much meant to complement one of the government's COVID cash transfer program that began at the beginning of the pandemic and continues. The second objective is we sought to create an operational model for shock responsive social protection programs that could be adopted, institutionalized, and deployed for future shocks by the Royal Government of Cambodia. This was strongly rooted in the Shock Responsive Social Protection Framework, which is a policy document developed by the General Secretariat of the National Social Protection Council, which provides 8 response options for how social protection programs can respond to large-scale shocks while complementing and reinforcing emergency responses by disaster management actors. One of the key program design elements was the use of government data and information systems for geographic and household targeting, mainly IDPoor and PRISM. And I'll describe these further in the next slide. Before moving on, though, I want to take this opportunity to acknowledge the financial support for the cash transfer program from GIZ on behalf of the German Ministry for Economic Development and Cooperation and USA Bureau for Humanitarian Assistance. Next slide, please. Program targeting was done in 2 steps. First, geographic, and second, household level. This is done by the WFP Vulnerability Analysis and Mapping, or VAM team, at the country office, and as a similar function that's done by WFP VAM units in other areas. The geographic targeting process was done at the commune level, which is a cluster of villages. To give you a sense, in Cambodia, there's roughly 1,600 communes. And this was based on an analysis of flood events in 2020, 2021. The analysis combined 2 data sources. The first was the flood extent from Earth observation satellite data. This was from European Space Agency Sentinel-1 and NOAA VIIRS satellites. This data was processed by the Asian Disaster Preparedness Center at WFP, and it was made available through the National Committee for Disaster Management's platform for real-time impact and situation monitoring system, or it's also just known as PRISM. And the other data source was the list of poor households at the village level, which was from the Ministry of Planning's IDPoor database. So the process was villages exposed to floods were aggregated to the commune level. Flood affected communes with the highest number of IDPoor households were prioritized. Then for household level targeting, all IDPoor households and prioritized communes were eligible for the WFP cash transfer program. Next slide, please. The 3 maps here illustrate the targeting process. The first shows the satellite-derived flood extent from October 2020. This was a map I showed earlier. This was combined with the second map, which shows the number of IDPoor households across Cambodia. And based on that, the result was the map on the right, which is the number of IDPoor households by village that were potentially exposed to flooding. Another important consideration in a geographic targeting and final selection was the government's own prioritization of the worst affected provinces in the Northwest based on their assessments and reports from the subnational level. Next slide, please. For the cash transfer program, this resulted in the following. There were 77 communes targeted in 5 provinces, and roughly 53,000 IDPoor households were targeted and eligible. The table here shows the breakdown of the number of targeted communes and IDPoor households by province, and the map illustrates the location of the targeted communes, which are clustered in the Northwest around the Tonle Sap Lake. Next slide, please. So it was very important to generate evidence on the cash transfer program, including the targeting approach, which I just described. This included WFP commissioning Oxford Policy Management, or OPM, to conduct operational research on the cash transfer program while it was being implemented, as well as WFP's own monitoring and evaluation, which included process and outcome monitoring and an internal lessons learned exercise. At the end of the presentation, I provided a link to the WFP Cambodia website where some of these resources will be available. The link was also provided in the chat box earlier. I'd like to highlight some of the key findings, and these are focused on the targeting approach, as well as the implications for shock response and social protection moving forward. So to start with the satellite data. First, there was much greater availability of and access to high resolution satellite data on flood extent than in the past. And this provided government and partners with a rapid snapshot of areas affected by the climate hazard. This information was available in PRISM, published in situation reports, and shared in humanitarian coordination meetings to inform the flood response. The flood response plan by international agencies for this particular flood event is available on Relief Web if you're interested. But there are some inherent issues with using satellite data. This includes satellite revisit time, data latency, and image artifacts related to the atmosphere and ground surface, which may lead to misinterpretation of images. Oversensitivity to seasonal water is also a particular concern. We're currently working with the Asia Disaster Preparedness Center and the Surveyor program, which is programmed by USAID and NASA to address some of these points in their hydrofloods application and in the PRISM system. And there's also the potential to better use field assessment data from NCDM to validate the satellite data, but these are still work in progress. Another issue related to how we managed geospatial data. So for example, in the targeting approach that I described, we identified a whole village as flooded and we aggregated the data to the commune level, but this may not actually accurately reflect the reality of the flood impact. Another point is that the satellite data on flood extent was not validated in the field in all areas to verify the severity and impact of the commune, village, and household level. Clearly here there are trade-offs. Field validation is very time intensive and process intensive, particularly for such a large geographic area. Of course, it can help to improve targeting, geographic targeting, and may minimize inclusion and exclusion errors at the household level. This has an impact on the time frame for the response. To some extent, this is related to both resources and capacities on the ground, but also more generally to whether government and partners are willing to take an anticipatory or early action approach on a no-regret basis versus a traditional, more reactive approach, which is often slower. Finally, there's ongoing technology integration work that was described in the earlier presentation between PRISM and IDPoor, which will improve the exchange and display of climate hazard and IDPoor data. For example, historical and current flood extent data can be quickly combined with IDPoor data to generate expected or estimated beneficiary caseloads to support preparedness and response. We're also in the process of establishing flood alerts and thresholds in PRISM, and this could trigger anticipatory or early actions with defined standard operating procedures and financing through disaster risk management and social protection systems for flood affected populations. On IDPoor data, the existing IDPoor database of poor households and the on-demand IDPoor mechanism enables government and partners to identify and assist poor households and can be utilized to respond to large-scale shocks. Near poor or households at risk or other vulnerable households are not yet included in the IDPoor database, but with the new and proposed changes to IDPoor, which were described in the earlier presentation, there is the potential to use the IDPoor database for horizontal expansion for shock response and social protection programs. This is also linked to ongoing discussions on utilizing other available data like the civil registration and the creation of a broader social registry in the future. I do want to highlight that during this research monitoring and evaluation, issues of social cohesion, of only providing assistance to IDPoor households while other non-poor households who were also affected by the shocks but not assisted was noted. It's important to note also, though, that the BFP cash transfer program was only one intervention amongst a much larger set of interventions by government and partners through disaster risk management and social protection systems. So it's important to take a holistic view of this in this regard. Finally, about 14% of the eligible IDPoor households in the 5 targeted provinces could not be enrolled in the WFP cash transfer program due to a number of factors. Overwhelmingly, this was due to outmigration, but also issues with the lack of legal documents, which were required by the financial service provider, being absent during the registration and enrollment process, or just not simply being aware of the program. This raises a number of concerns, some of which I'll just briefly mention here. One is issues potentially with keeping the IDPoor database up to date by the commune authorities, as well as concerns with program outreach, particularly in remote areas or with particularly vulnerable populations like the elderly or persons living with a disability. The shift, though, to on-demand IDPoor, the fully digitized process, ongoing capacity strengthening efforts, and the complaints feedback mechanism, which were described earlier, are important steps to address some of these issues. Next slide, please. To find out more about WFP's work in Cambodia, this is our website. Thank you.
Thank you very much, Kurt, for your presentation. I see that we already have quite a number of questions being posted onto both the chat box and also the Q&A section of the webinar. I will, for the ease of the panelists, I will read them out for you. I have also attempted to group them, the ones that are relevant. Maybe I will jump immediately to the first one here from Weilin Shi. 2 questions. How often such interview of the household will take place? And number 2, only verified household will be registered in IDPoor or all applicants will be registered? Is it at household level, right? Maybe more for Radit. Would you like to comment?
Yes, I think the first question is all the interview will be conducted at the household to see the housing situation for each household after the request for interview. And what is the second one? I cannot find.
How often is the interview taking place?
How often?
I think since we do it on demand now, maybe that is the answer. It used to be rounds.
Yeah.
So then it used to be once every 3 years.
3 years.
So.
Yes. Yep.
Yeah. But the emphasis here perhaps is that we have now moved away from the round concept. Therefore, it is on demand. Yeah.
But the validity is still 3 years. So after first access, so if they're still poor, within 3 years, they will get another reaccess. Yeah. Reassessment. Yeah.
Perfect. So then you confirm that households are registered. The question also is whether everybody, only applicants, only the ones who are successful will be registered in the database, or both the applicants and the ones who are successful?
I think to get, yes, maybe I will try to answer. I think first to get the interview, household have to come to commune office and request for interview. So after receive the request for interview, within the monthly meeting, commune council together with the other commune working group, also the village chief, the representative for the household, will consider whether this request has enough criteria for or eligible criteria to get the interview or not. It's kind of, sometimes it's not everyone that requests get all the interview. It's still according to the screening and the decision from the commune according to their condition. Yeah.
Yeah.
I think, Radit, the question is.
Can I add? Sorry. To add on. So as Radit said, not every household that requests an interview is necessarily stored, but once an interview has taken place the results of the interview are stored in the IDPoor database, not only for those who are then identified as IDPoor households, but also for those who are not identified as IDPoor. Yeah.
Yep. Thank you, Sophie. I think that first round of answers might also have addressed the question from Rani Singh about how often is data updated in the IDPoor? What mechanism supports this? Anything to add to that question?
Yeah, I think the data is updated every day. So according to requests from household, and we also implement another, we call it editing function. So for the household that already pull into our database, they also edit their data later on. For example, if there is some typo in the name or wrong age, they can also do it to update their data.
Perfect, thank you. Then moving on to the second one from Camille Valtier. Regarding the OD IDPoor system, are the households identified in 2020 still benefiting from the program?
Short answer, yes.
Yes. Then I move on. Next, two questions from Zakaria Al-Nafi. First one is, how reliable is the data protection policies, specifically that volunteers are conducting the emergency identification data, which can be used for other purposes in the future? First question. Second one is about, as it is a real-time online process, can the app being used to self-identify people, which could save time, effort, and money?
Yeah, so answering to the first question, I think for the data protection policy at the time, for the volunteer, what they can do is that only collect data and sending to the database. They don't store any data on their mobile phone. This is the first one. And also, I think we have no choice at the time because it's lockdown. So it's kind of really difficult for government to looking for people to help us on doing the interview during the lockdown measure. So I think this would be my answer. It's kind of sometimes we have no choice. Yeah.
Yes.
And
the second question, should I repeat? It reads, as it is a real-time online process, can the app being used to self-identify people, since that would save time, effort, money?
I think for now, for this, thank you for the second question. I think for now, according to introducing the public IDPoor app, for us, it from the system, from the technical part, it potentially possible for us to allow people to do self-identify, but it's still according to decision from the government. But from the technical part, it's possible for us to do so.
Might be coming that via the app that people can then very quickly.
Yes, yeah.
That would be quite a big leap. Perfect. Moving on, I have two sort of similar questions. I will read both of them. The first one is from Wala Talat, and the second one is from William Niuni. The first one reads, can you elaborate more about the variables used in proxy means tests? Is there a recertification for the eligibility? If so, what are the means used? Also, do you measure the exclusion error of the PMT? What percentage? What are the steps taken in this regard for the excluded poor? Many questions there. Maybe I let you answer first.
Sophie? Yeah.
Jump in. Yeah. Feel free to jump in. Yeah, please.
Yes, okay, so the question, can you elaborate more about the variables used in the proxy means test? So the first comment is we are currently working on a new proxy means test. So we are using the Cambodian socio-economic survey to estimate which variables best estimate the consumption per capita of a household. But the proxy means test that is currently used, and also in the future, it looks like a lot of variables will stay. These are variables that relate to, for example, how big is the space that the household lives in and how many people are living in that space, what is the quality of the material of the house or apartment or wherever the household lives. But so these are variables that can also be observed. So it's always important that the interviewer actually interviews each household where they live. But there are also variables that relate to the education of the household members or the occupation of household members. So it's a variety of variables. And as I said, it's currently being renewed based on the Cambodia socio-economic survey. Is there a recertification? Oh, now it jumped. Recertification. I don't know exactly what the question means. I don't know, Kevin, if you can help me out. Otherwise, I will just. So if that means if there's a decision being taken whether the proxy means test actually is accurate, then yes, for each interview, the commune, there's a working group in the commune that will receive the results of the interview, and they can discuss the results of the interview, and if they have any questions, ask for more information or updates. And they can also consider special circumstances, because of course we are doing the best to make the proxy means test as accurate as possible, but at the same time, no proxy means test is perfect. So we have special circumstances, and the commune council can reason to overrule the proxy means test score and say, even though this household would not qualify as poor based on the proxy means test score, there are special circumstances, and therefore, based on this local knowledge, the household is still considered poor. With regard to, I just now take on the whole question, Radet, please interrupt me if you want to take over. Regarding the exclusion and inclusion error, yes, MOP, so the Ministry of Planning measures exclusion and inclusion errors and monitors it. Last thing I knew was that it was both about 15%. And what are the steps taken in the regards of the excluded poor? I think one huge step forward is the public IDPoor app that Radet has mentioned. So yes, so that first of all, people can request interviews also via the app. I also saw a question whether all poor people have a mobile phone. Probably not. So interviews can still be requested at commune councils or local authorities as well in paper form or just orally. So it's not the only part, but the public IDPoor app plays a big part in reducing the exclusion error, and also the objection and suggestion management. So anytime someone feels treated unfairly, they can register a complaint via the public IDPoor app or also in person, and then this will be looked into. Radet, if you have something to add?
Yes, sure. So I think maybe regarding to exclusion, what I want to add is that after we introducing the on-demand IDPoor, this problem is kind of we really try to not try it already minimize a lot of problem of the exclusion error. So because from the difference between on-demand and round is that for on-demand people have the chance to get the interview or to get into the system like every day 24/7, something like that, compared to the round where the round is closed, you are closed as well. You have to wait until the next round is open. So for exclusion, I believe that OD IDPoor now it's already have a lot to solve that. Also in the future, after we introduce the public IDPoor, it's another level of to add on top on the current IDPoor application. I think for inclusion, from the procedure and technical part, what we have done is that we develop the disqualify function from our app as well. So within our IDPoor app, it's not only the platform that just allow people to get into the database, but there is also the way that we can kick people out from the database as well. So if the household that have their living standard or improving the livelihood, the commune council or people that living with the same area can request to disqualify those households to list them out from the database as well. And also from the public IDPoor app, there is also a request from the public app to disqualify household as well. So maybe from this, not only the commune or the working group within the area that could do it, but the citizen that living surround can help IDPoor to have a better data quality as well regarding to exclusion and inclusion error. Yeah.
I think both Sophie and Radet, you addressed a little bit already the two questions that I saw. One was from William, as I have mentioned, William Niuni, where the question reads, how do you ensure that inclusion and exclusion errors are minimized in the identification of vulnerable and poor households in your platform? And also secondly, from Wala Talat, again, where it's mentioned we need more elaboration in regards of the prioritization process and targeting. I think you've spoken a lot on those two. Anything else to add before I move on? If nothing comes to mind, then maybe I would like to call upon Kurt. This particular question, if you see on the Q&A from Sabina Sasso, could you elaborate a bit more on other key findings, lessons learned, especially from the implementation of the cash transfer project, and if how they have informed the elaboration of the National Shock Responsive Social Protection Framework? Kurt?
Sure. Thanks, Kelvin. Thanks, Sabine, for the question. So I have maybe 4 or 5 other sort of key findings that came out of the implementation of the cash transfer program and which are documented more fully in the OPM report. I would maybe start with one that I think is quite important for IDPoor, but it is also important for any type of the social assistance programs provided by government or development partners. And this is this issue around at the commune council and at the village chief level, issues around capacities, time, and resources to really manage the process. And I think this was something that we have heard from the operational research for the cash transfer program. We've heard from the review of the IDPoor process that has been ongoing, and from other actors, which is there's really the focal points at a commune and at a village level who are instrumental to making this happen have a lot to do, not just to support the IDPoor program and to support cash transfer programs. And, you know, in many cases, you know, they have you know, limited time and resources, particularly when travel is involved. And so I think this is something, you know, it is being addressed, as I mentioned in my presentation, around ongoing capacity strengthening efforts that Ministry of Planning, Ministry of Social Affairs, others are doing to really make sure that those local authorities are capacitated, have the tools in place to really be able to manage these processes well. But I do think that's a really important point moving forward, that these focal points at the commune and village level just don't, that there's a recognition that they should not be overloaded, and if they are overloaded, that will have an impact on the quality of service delivery and management. So you know, steps there in that regard around capacity strengthening, which I mentioned, but also there's a broader deconcentration, decentralization, or D&D process that's been ongoing for a very long time within the government, which is you know, shifting authority and resources from the national level to the subnational level. You know, this is important to keep in mind, so that you know, those officials are better able to implement these programs. Another point that I think came out that is important is around inclusion. So some of the things that came up from the operational research were concerns for IDPoor households that were in particularly remote areas, but also IDPoor households which consisted of particularly vulnerable households. And here I'm thinking of primarily the elderly, elderly with small children in the absence of parents, but also households that have people living with disability. I think they had, in some cases, some particular issues around enrollment in the programs. They had issues around access to the financial service provider, and due to the distance and travel time. And I think that also influenced another one of the findings, which was from some of these same households, there was, and I think for me, quite surprisingly, there was in some cases, a preference for a different transfer modality. So they, in fact, would have preferred in-kind assistance, like a food package, for example, or other non-food items, to help them with the flood response and recovery to other shocks than the cash assistance. And again, I think that was related to issues that they had around accessing the financial service providers. So I definitely think that that's something that needs to be kept in mind, and particularly when looking at the different response options in the shock response and social protection framework, it is overwhelmingly focused on cash assistance. But there may be a need to look at sort of mixed transfer modalities, for particular cases. And here I'm definitely thinking of very remote areas. Another issue I think was around the financial service provider and the financial instruments that were used. In this case, WFP used the same financial service provider as the government does for its cash transfer programs. But what was different was we used a different financial instrument than them. So WFP had, one of the objectives was a financial inclusion objective. So the financial instrument that we chose was opening bank accounts for all the beneficiaries, which is different from the financial instruments that the government uses, where they don't open where they don't open bank accounts. And by doing so with the financial inclusion objective, we wanted to enable these poor and vulnerable households to be able to have a savings account, to be able to access other financial services like receiving remittances. I think this, as a result of this, the enrollment, the registration and enrollment process for WFP's program was particularly complex. And I think one of the lessons from that is if we are to go that route, we need to greatly simplify the process within what is legally allowed in terms of the rules and regulations that the financial service provider has to follow. But just more generally, I think even looking at the financial instruments that the government uses, I think there's an agreement amongst many actors here that perhaps there could be efforts made to really create a tailored financial instrument that doesn't exist yet, that is specifically for IDPoor households. That really makes the process of enrollment and registration and use of it much easier than the current systems. I think the last point that I'm going to make is around the transfer value. So for WFP's cash transfer program, for the first time, we had used the calculations from the minimum expenditure basket, or the MEB. We hadn't used this approach previously, so we had just done this for the first time for the cash transfer program, and this was used to help inform the cash transfer value. One of the things that we didn't do that I think moving forward is important is having a means to adjust it. And this can be, for example, monitoring inflation, but also using M&E systems to be able to see whether the amount of the cash that's being transferred is adequate for stated objectives or not. And I think this is something also moving forward, where in fact right now WFP, in partnership with Save the Children, are in the process of reviewing and validating the minimum expenditure basket. And this includes both utilizing the latest household data, which comes from the Ministry of Planning's Cambodia socio-economic survey, or the CSCS, but then also validating it with particular vulnerable groups in the field. And as a result of this consultative process, I think we'll have a more robust minimum expenditure basket, understanding of what it is, and potential uptake and application, both for government social protection programs and with humanitarian partners who do cash transfer programs. Yeah, so I think those are sort of four or five areas that I think also stick out to me. Thank you.
Thanks, Kurt. Maybe here might be a good time to, as we drill further, unpack more into the details of both the programs, both IDPoor and also the WFP cash transfer. This question on grievances mechanisms. Maybe Radet and Sophie, if you have you touched upon it already just now a little bit in some elaboration, if you can, on this question, and then followed by Kurt with grievances mechanism of the WFP program. Radet first or Sophie first?
Yes, so I think from us this year it's public IDPoor app that we call that we already mentioned during this webinar is kind of actually our grievance or complaint mechanism. So in that we have kind of multiple complaint or requests, like request to interview, or you are sometimes you are unhappy with the local implementer. You can also anonymously provide the feedback to that, and all the feedback will not go into the commune tablet, but instead it goes to PDOP and MOP, to Ministry of Planning, or to Provincial Department of Planning to see what's happened in the ground. So I think for public IDPoor app, what we aim is that to have a better picture what happened in the ground, compared to before that we have only a paper-based monitoring tool, something that we cannot see, and it's kind of lost at some point. But for public IDPoor app, I think it could help a lot for us to have a better picture.
So the app is emphasized. Sophie, anything to add?
No, I think Radet pretty much covered it. I also think that the app is a huge step forward. Before, obviously, it was always a possibility to also call MOP or write an email, but I think now it's more institutionalized how people can complain. So, yeah.
Kurt?
Yeah, so for the WFP cash transfer program, we established a complaint feedback mechanism with different channels at the beginning. The primary means was through a call center hotline that we contracted and set up. It was available. It was a free call available, 24/7. That was available when all the beneficiaries were enrolled in the program. It was also the information was available at all the financial service provider agents, so that beneficiaries had access to it and could utilize it. I'm sorry, I don't have the numbers on the number of calls that we received for it, but I can say it was quite used, and not surprisingly, most of the feedback that we got was around, how do I get enrolled? When is the next distribution? How much is the value of it? I forgot my PIN number, etc. So it was valuable from that perspective to be able to provide very, very quick feedback through that channel. There were also other channels as well, through the local authorities, so the commune chief, the village chief and the commune council focal points. They're the closest point of contact with beneficiary households in the targeted villages and communes. There was a means for beneficiaries to contact them if they had questions or concerns, and those local authorities in turn could pass the information on to WFP. Another layer that we had was we had ongoing process monitoring that was being conducted both by WFP field staff and also by a local cooperating partner, an NGO called Life with Dignity, that we cooperated with on the implementation of the program. So those were the sort of different channels that we had set up for the complete feedback mechanism. and based on the lessons from that, we're now in the process of consolidating it and updating it moving forward. Thanks.
Thanks for elaborating. Moving on, next question here from Weilin Shi. Could IDPoor data also support concerted efforts among development agencies? Would that be the possibility that some households will receive multiple benefits? Any thoughts from?
I think, yeah, thank you for the question. I think currently the household is receiving multiple benefit already. For example, in Cambodia, we have cash transfer, we have the health equity fund. So they also, if they are the the IDPoor card holder, they also get the free healthcare service as well. And there's also some other program as well, but I believe that currently a household that hold a equity card, they can receive multiple benefit already. Yeah.
Any thoughts, Sophie, Kirk?
No, not from my side.
Yeah, I mean, I don't have any particular thoughts, just maybe to add, I mean, I think it's already been the directive from Ministry of Planning that has been in place for quite some time. MOP, Joseph colleagues, you can remind me when it was in place, but you know, I think the acceptance and use of IDPoor as a means of targeting all forms of assistance, you know, has been, you know, is widely accepted and it's been used for a number of years. But I think one sort of blind spot, which is pointed out in the question, which is this: no one really knows whether particular households, all the assistance that they're getting. I mean, it would be straightforward to be able to do that for the assistance coming through the social protection systems. But then that's coming, but also assistance that if other partners, international organizations, local NGOs are using IDPoor to target assistance to poor households. So I don't think we have a good view on that. So I think more is required in that respect.
Okay, now I want to add something, if I can.
Please.
Yes, so we do not know exactly which household receives exactly what kind of assistance, but we regularly do a data user study, and we know that there are, I think, in the last, since IDPoor started, there were more than 200 data users who used IDPoor data to provide services. And they do not provide services always nationwide, but sometimes geographically very specifically. So it also depends on the region that people live in. But so we have a good idea on how many people actually use IDPoor data. But yet we cannot say now for the specific household which services are being received. But I think this is also something that is being discussed, whether some kind of beneficiary registry can be set up.
Maybe at this juncture would be good to pick up this particular question from Dr. Hamidul. Sorry, the system cut off your name here. I only have your first name. Thanks for the presentation. Could you provide us with the details of existing accountability mechanisms, and how is the coordination in terms of governance between the actors, government and donors, international institutions such as WFP? Could somebody elaborate a little bit on how?
Yeah. Kelvin, I can take the second half around governance and coordination, and I think this is an excellent point. So I think there are different coordination and governance structures, whether we're talking about social protection or if we're talking about disaster risk management. So I'll start on the disaster risk management side. So there's the National Committee for Disaster Management, which is the interministerial mandated government entity that's responsible for disaster preparedness and response. And they have a presence at all all administrative levels. So there's a provincial committee for disaster management and a corresponding one at the district, commune, and village level. And those are comprised of both local government authorities as well as focal points from particular line ministry departments. So a lot of coordination happens there already. There's also another coordination body for those who are familiar with the sort of IASC global cluster system that is deployed for emergencies. There is a customized version of that for Cambodia that has existed for about 10 years. It's called the Humanitarian Response Forum. And this consists of more than 60 INGOs and UN agencies together with the Cambodian Red Cross, NCDM, and other actors. And this is a standing body that meets on a regular basis. You know, in the low risk season, it's concentrating mostly on preparedness. And then during the rainy season, and particularly the height of the flood risk season, which is beginning now and until, let's say, October, there is a shift towards readiness, and in the event that there is a response that is required because of a large-scale flood, and there's very regular humanitarian coordination meetings that are led by the different clusters, or here they're called sectors, and that they work very closely with Cambodian Red Cross and NCDM and their subnational committees around the response. And there are, for example, joint situation reports that are regularly published. There is information management on the response done on 4W's online dashboard to really be able to track what the response is by sector and by particular area. Within the Humanitarian Response Forum, there's also a cash working group. So it allows actors, international agencies who are providing cash transfer programs to be able to have standards and coordinate their response. So that's on the disaster risk management side. There's a completely separate set of governance and coordination mechanisms around social protection. And I think these are, because the social protection architecture is more new and nascent, I would say, compared to the disaster risk management. There have been some coordination structures that were traditionally just among development partners, and then of course interministerial ones within the government. These are now merged under the overall governance of the General Secretariat of the National Social Protection Council. There are 4 of these interagency and working groups that exist that enable this coordination to happen. But at the subnational level, I think it's less coordinated. And although it's important to point out that the provincial departments of social affairs, which are then in turn helping to manage the various cash transfer programs that are being provided by the government, do play a particularly key role here. I'm not sure if that completely answers the question, but yeah, that's my contribution.
Yep, absolutely. And I think what I can try to link the previous discussion to this one, the answer you've given, Kurt, is to supplement with the point that the National Social Protection Council is also starting to look into more holistically who is getting what benefits in relation to the earlier question that maybe to avoid or to ensure that even if multiple households are getting the different benefits, that's by policy, by intention. Maybe here to Radit and Sophie, there is another question regarding governance, so very much linked. Who is monitoring the IDPoor software application? Is it a private company as part of the public-private partnership?
Yes, I think right now we have a contract with a private company, the local company in Cambodia, who maintain and monitoring the IDPoor database and software. Yeah, it's not public; it's private.
Private company. And within that whole thing, I think one question that was asked in the previous one, the first part, Kurt answered the second part, the accountability mechanism. I don't know if any one of you would like to speak more to overall, whether IDPoor or overall social protection accountability mechanism beyond what Kurt might have touched upon. If there are no additional thoughts, then I jump right next to the next question here. I think first one, how the criteria of 3 years validity was chosen. Maybe some history.
I think it was chosen by from during the round implementation. Since we have the government have the limited budget that we cannot doing the round collection together in all 25 provinces in Cambodia. So we split the province into 3 pieces. First, we have each round we have 8 or 9 province to do the identification, and we assign the 3-year validity for the household. So within 3 years after the circle coming back to their area, they can get another identification, another reaccess, something like that.
Thank you.
Kevin?
Sophie?
Just because I realized that maybe there was a potential for misunderstanding regarding this private company or public company question regarding governance. So to clarify, there is a private company that develops the software and that also supports with maintaining, but all the rights for monitoring and for managing permission schemes and so on are with the Ministry of Planning. Just as, yeah, because I know that you were talking about the company that supports the development and everything, but the rights for permission schemes and monitoring it, the whole database is with the Ministry of Planning.
I was talking about the company that keep the system running. That's it. Yeah.
Thanks for emphasizing this because I think here Ms. Wala Talat also then posed a further question regarding this accountability mechanism. Thanks for clarifying. Here from Rani Seng, how reliable is scoring system for IDPoor? Are there any updates or adaptation of the criteria during COVID-19? Sophie?
So I'm not completely, yes. So with regard to reliability, I think we have already touched upon that topic somehow regarding the updates. So for COVID-19, the questionnaire that was typically used was not adjusted, but there was this emergency identification. There was a lockdown in Cambodia where people in some areas actually could not leave their houses at all. And for this emergency identification, the questionnaire was adapted. And yeah, there were a lot of interviews just within 2 weeks to identify households that can actually not leave their apartments or wherever they live so that they can get some kind of support. Now the regular questionnaire is now being revised and we hope to have it available soon, yeah, with the launch of the new system.
If there is nothing additional, then maybe we can spend a few more minutes here with the last question. We're very good on time here. What is the role of stigma in accessing this cash transfer program? Kurt, or from your observation from IDPoor, any thoughts, Radit, Sophie?
Yeah, I mean, I don't have a lot to say on this. I mean, I think, you know, I did allude to the fact that we did pick up on some issues around social cohesion. So obviously, if it's known that IDPoor households are receiving different cash transfer programs, you know, communities are small. Everybody knows everyone else's business. You know, so I do think that that there could be an element of stigma there. But I think, I mean, at least in relation to the BFP cash transfer program, this, as I mentioned in the presentation, this was, you know, one among many other forms of assistance that were being provided both by government and development partners to poor households. I mean, I think it's widely known, it's widely accepted. You know, IDPoor has been around for quite a long time. Although corresponding social assistance, social protection programs haven't necessarily always been there to be able to provide registered IDPoor households. But in the last several years, as a colleague Radet demonstrated from the COVID cash transfer program and also the one-off program that was provided by government due to the lockdown at the beginning of last year. You know, I think it's it's widely accepted, you know, that these cash transfer programs are being provided to poor households. And you know, the government does a tremendous amount of communication and outreach. You know, whether I get pop-ups in Instagram and other social media, you know, really nice communication outreach campaigns by the National Committee for the National Social Protection Council around the social protection program. So I know that they're also making a lot of efforts in that regard for outreach and communication.
Radet, Sophie, do you have anything to that stigma question?
Yeah. Yeah, maybe I can try to elaborate more. I think from the stigma regarding to the identification or stigma in IDPoor, normally we cannot say that it's not happened, but we believe it happened, but very small case, because there is a few cases that people just coming into the 6th floor of IDPoor of Ministry of Planning Building to coming to say that I asking for interview to get a equity card, but my local authority, my representative does not accept my request. So what we have done is that to asking for our PDOP, the provincial department of planning to see that case, to go into the real situation, whether the household is poor or not, and why the commune is like doing kind of stigma like this. So, and also I think from us, we also have the grievance or complaint mechanism as well, that people can always give their word to us, because sometimes if the word is only in the ground and it's not coming to the top level, we cannot do anything. So there are also the case that we solving the problem by a comment in the ministry, the prime ministry channel. So there's a few cases that people comment into the Facebook page of our minister. So our team also react quickly to solve that. And some case, what we found is that, yeah, it's completely different from what they comment. Yeah.
Okay,
but I think
perfect. Thank you.
overall, maybe in overall, in our identification, we accept every request, regardless of your party, regardless of your belief. So this is our what we are doing right now. Yeah.
Thank you very much. We are right down to the last minute now, on the mark. Thank you very much to all the panelists. I hope that all the participants, you enjoyed the last 1.5 hours with us, unpacking, really going into some details about Cambodia, what many things, really exciting things happening here in the country with regards to social protection. I don't know if there is this clapping button. I don't see it on my web access to Zoom. If you have, please join me to give the panelists a round of applause. Before we close, I would like to invite everybody. I think after the webinar, you will get an email. Please do spend a few minutes for the post-webinar survey. Always important to know what you think, or how you find the webinar today. And also come to the socialprotection.org website for the recording and the slide presentation, for those of you who would like to get access to that. With that, then thank you very much for your time to join us. I would like to bring the call to a close today, wishing you a very nice rest of the day. Thank you so much, everybody, for joining. Goodbye.
Goodbye. Thank you so much.
Thank you. Bye-bye.
Thank you, everybody. Bye.